Okay. Okay, folks, we are going to start recording now. I want to welcome everybody. I'm going to open us in prayer because I'm also a minister. Lord, I ask you to bless this wonderful little group, but I ask you to help the millions out there right now that their healthcare is on the block, like myself and several others, and those struggling without it. I ask you to use this vehicle as a vehicle today to help those, show those in power, show those who don't understand what they need to learn and know that this is very important and why you need to care about healthcare and why you need to support it. I ask that you open the minds of other advocates and activists from other walks of life, climate change, gun violence prevention that are not on the fence, and have them start to open their hearts and make some phone calls to help our healthcare and help our rents and get involved. Because together we can, will, and shall, Lord. United we stand, divided we fall. So we need to become united. And I ask you to unite us and today to be a first seed in doing that, Lord. And I thank you in the blood of Jesus' name. In Jesus' name I say amen and bless everyone on this call. Bless Brian. Bless Destiny. Bless Susan who's coming on. Bless Letha. Bless Tawana. Bless Miss Joey. Bless everyone who's been kind enough to donate their time to me tonight for this wonderful cause. Bless them, Lord, in the blood of Jesus. And Isaiah too, in the blood of Jesus' name. In Jesus' name I pray. Amen. Let's rock and roll,
Amen.
guys. Without further ado, I want to bring on first Miss Destiny Smith from Catalyst Miami. She's going to do about 5 minutes on teaching you guys about climate change and how it affects your health. Destiny and I will give you a little purpose. Destiny is one of the best climate change activists in the country. She's nationally renowned. She was featured on Louis Aguirre's Don't Trash Our Treasure on Channel 10 locally as one of the best climate activists. She spoke at the climate summit last year in Miami at the Miami Beach Convention Center. Very, very well-regarded, well-renowned young woman. Also can do housing, Brian, too, because she taught me about housing. She's very good at that. Also can do healthcare. But we had discussions last year about, because I was concerned about workers that had no healthcare falling out in the sun. And they had posted on this. So, without further ado, I'm going to let her go ahead and speak on this for about 5 minutes. Jess, are you ready?
Hi,
Destiny, you ready?
everyone. Yes, can you all hear me?
Yes,
Yes.
we can.
All right. All right. Sorry, everyone. I am in the midst of traveling, but I wanted to make sure to be here to support Fred and Impact. So I'm so honored and thankful to be here tonight. But as Fred mentioned, I'm with Catalyst Miami. My name is Destiny Smith. I'm the Director of Popular Education and Grassroots Leadership. And just going to briefly touch on how climate and health are interconnected. Currently, we're running and actually finished up our CLEAR program, which is our climate justice program that ended last night, where we are talking about how for many of us right now, I'm like in my car and I'm like the AC is blasting and it is extremely hot already. They're already talking about it's going to the 90s in the next couple of days here in South Florida. And so for most of us, we are impacted by climate impacts pretty much every single day, especially here in Florida, whether it be extreme heat, whether it be the flooding that just happened earlier this past week in Brickell and in downtown Miami, or whether it be stronger storms we're currently about to embark in hurricane season as well. And so we're all impacted by climate and the climate change crisis. We're seeing hotter and hotter record breaking heat every single year. We're topping record levels every single year. We're increasing our risk for flooding and storms. And the folks that are most impacted by this are going to be the folks that are marginalized, the folks that are working outside, the folks that are houseless, people that are outside in these conditions are some of the people that are most and worst impacted. Folks that are living in even poor housing conditions where they may not have quality AC, where their landlords are slumlords and they're not taking care of their buildings and they're not up to code. And so they are impacted by so much of these concerns that we're facing every single day. And I know Brian was even sharing some of his story earlier, just as we got started in the call. And so folks are experiencing not only climate change issues, but also the impacts of health and how we are a state that has not expanded Medicaid. And so a lot of folks if you are working outside or you are living outside and you do not have access to health care or health insurance, you're going to be somebody that stands in the gap from getting the quality care that you need, especially as somebody that is an outdoor worker, someone that has a struggle with their immigration status, where they are unable to access quality health care. And so these are some of the places where folks are landing in the gap in our state, especially because of the extreme heat and especially because of just the impacts of climate change. And so, because of that, I just wanted to share, as Fred mentioned, it is so important that we take an intersectional lens on the climate crisis. It's not just something that is happening to the sea. It's not just something that's happening to the whales, but it's happening to our communities, Black and Brown, and all over the state of Florida, and especially here in Miami-Dade County. Folks are experiencing the impacts of climate, but it also has a major impacts on our health and whether or not you have access to healthcare. And so if you are a person who is elderly, if you're a person that is of a vulnerable population, you have asthma or anything of that nature, if you're going to be out in extreme heat conditions like the such, and only getting hotter and hotter, that creates extreme risks for heat stroke, for other heat related illnesses, or even in extreme cases, it could be death. And we see here in the state of Florida, but in particular in Miami, there's studies shown that I believe it's about 4 outdoor workers around every couple of months are actually do die on the job because of heat related illnesses and because of poor working conditions. And so we have to take into consideration what it is that we're giving our communities access to, and whether or not we're actually caring for those most and worst impacted as things get more as things continue to get hotter here in Miami, as things continue to as threat of storms, as threat of increased flooding continues to happen, whether that, especially if you're living in, maybe a community or an apartment where you have a slumlord, and if it floods in your apartment and you don't have that person to come and to help, you are experiencing water intrusion, water damage, mold, mildew, and all of that also contributes to poor health outcomes as well. And so we have to take an intersectional lens on this, and especially for those that are worst and most impacted. And so, yeah, if you have any questions, please let me know. We are hosting our CLEAR program and also our LIGHT program, which is our health justice program. Florida Voices for Health and Acadia has been a part of that program for the last couple of years since we've launched it. And so that is also a place where you can learn more about this issue and how these two things are interconnected. And so if you want more information, you can look on our website at catalystmiami.org/clear or catalystmiami.org/light. So yeah, that's my time. But
I want to thank you for coming on. I want to ask 2 of my panelists, do they have any questions for you before I go to Brian? Tawana, if you're available, do you have any questions for Ms. Destiny?
I'm sorry, let me just start. Yeah, hold on, Fred. I just wanted to react to Destiny's personal situation myself last year as a senior citizen with multiple conditions, blood pressure, diabetes, and cancer, that last year in the 110-degree heat, passed out on the street, cold because of the heat, and they had to call. Ambulance came. Next thing I knew, walked in the back of the ambulance, and they took me to the ER. I'm attending the meeting tomorrow night on transit because initially we had last year. Transit is we're out there waiting for the bus, an hour and a half, 2 hours. Senior citizens in wheelchairs and walkers waiting for a bus. That's absolutely not. It's not acceptable. So I'm going tomorrow night. It's not acceptable. You can't have people out there, especially in Black communities in Overtown and Liberty City. And you can't do that. I'm from New York. Everybody rides the subway. Years ago when I was little, the subways and buses didn't have air conditioning. Or excessive heat. I was on a bus yesterday. The air conditioning did not work on the bus, and people were passing out on the bus.
Yeah, and especially when you look.
Did you contact MDT and tell the commissioners?
No, you
wouldn't tell them that. Did you tell them that? Make sure you tell them that, because somebody needs to hear that. Mayor Cava, somebody needs to hear that, even Torres.
I am putting it on.
1 second. What they told me, I'm sorry, 1 second. Transit told me that they are not obligated to provide air conditioning on a bus. It's not a driver.
Oh, come on.
That's what they told me. I'm telling Keon, I went to Keon's office last year about that to file a complaint about the 77, the 21, and the 7 waiting out in 100-degree weather for 2 hours.
Right, because because the problem is we don't have enough new buses. Destiny will tell you the fuel cell buses are great. I've ridden on them when they bought them, but those old crates they're still running, they ain't fun at all. I was on one in 2013 and it broke down. I had to wait for it in the sun. Because what they do, they
There's
tell you get
not.
off the bus when it breaks down, and then they make you stand out in the sun. I mean, really,
Wow.
we can do better. But that's another Zoom for another day we can tackle. I want to ask real quick before you go on, Brian. Miss Joey, do you have any questions for Brian, for Destiny, or do you, Tawana, real quick? I know
No,
you're both on.
no, I don't. No.
Okay. Thanks, guys. Thanks. Okay, Brian, go ahead.
Well, I guess the only thing I really wanted to share was
Let
only
me introduce you first. Let me introduce you properly first. Ladies and gentlemen, I was blessed enough to meet this man. He's a wonderful guy, really great guy, and I'm looking forward to working with him and meeting him in person. I saw his story about 3-4 weeks ago.
April 7th.
Right. Okay. April 7th. Ironically, 2 days after we did the weekend summit, I would have loved to have Brian come and speak to those seniors, and one day we're going to have that happen and make that happen. But he was so powerful, and he was down at the PAC summit with this Miami Worker Center who he works with, and he was so powerful and so eloquent. I said, this is one of the people we need, because this man can deliver on both these issues, and both these issues are important. So Brian, you're a great broadcaster. You're a great pillar in New York City. You did a lot of great things in your life. Welcome to Miami from us. We love you. We appreciate you. Mr. Brian Douglas, ladies and gentlemen, welcome to the family of advocacy.
Yes, thank you, Fred. Moved to Miami in 2019. This was supposed to be a permanent vacation until 2024, when I was subject to an illegal eviction, where the building where I was living in is going to be torn down and sold to a developer, and 20 elderly and disabled people, most of the minority, would end up on the streets with no notice whatsoever and no compensation. That's when I joined Miami Worker Center, and we have the eviction diversion program. And my punchline, my catchphrase on that speech was the eviction diversion program saved my life, because if I had to be on the street last year in 110-degree weather, I wouldn't be here. I went to the hospital. I passed out in September. It wasn't that bad, but I went outside a couple of times. I think it was in July, just to see how bad it was. I walked out my front door. Within, I think, 10 minutes, my clothes were soaking wet in perspiration, as though I had been in a rainstorm, and I had to hightail it back to my house. So, I don't know what these landlords are thinking about how they want to evict senior citizens and put them on the street. Are they crazy? I don't know. Well, the greedy, we know that for one. But I rose up to the cause when I finally got my affordable housing, which is very, very limited in Miami-Dade County. I was blessed to get that in Sawyer's Walk, and that's my forever home. I'm worried about all the people left behind. How many people live in Overtown or Liberty City that are on Social Security and only bring home 1,000, or on SSI, and their monthly is 500? I don't have the answer to those questions. But what I'm doing right now with eviction diversion, I can't save everybody, but I'm an ambulance. I'm a MASH unit. I'm going out there fighting for the people, and let's stop the bleeding. Because in New York City, where they have the right to counsel law, we are entitled to an attorney if you are in the process of being evicted. Evictions dropped dramatically, because landlords are just not going to be evicting entire buildings if they know every tenant has a lawyer. So that's what we're fighting for right now. That's my personal goal right now, is to get eviction diversion extended for another year, make it permanent, and eventually have it codified as right to counsel. Next mission is to go off to Tallahassee and get Tenants Bill of Rights. I'm going to Washington on Tuesday for another rally. I don't know how to do this. And we have, right now, we have 500 people at this rally on Tuesday. My ultimate goal is Martin Luther King, I have a dream speech, Million Man March. We're going to do this in downtown Miami at Government Center. We're going to do this in Tallahassee, and we're going to do this in Washington, D.C. That's my life goal. That's it.
Love it. Can you please answer a few questions for me, though?
Sure.
Like you elaborated earlier. Okay. Can you tell us what you went through health-wise doing this whole thing when they told you were evicted? Can you just tell us what it did to you and why? Now, I want you to tell them, one question, did you have health care when you were going through this or no? That's my question I need to know. Two, did you have health care or no?
Yes, no, I was again fortunately blessed that I did have health insurance. Well, no, I have health insurance because now I get Medicare because I'm over 65, but I've been on disability for about 20 years because of stress. And part of my medical care plan is to avoid stressful situations. Someone knocking on your door and telling you you need to leave tomorrow is a stressful situation. But I did sleep for 2 months, lost a lot of weight, pre-existing condition flared up. At one point, I thought I was having an asthma attack and couldn't breathe. I called 911. Hospitalized for 2, which all could have been avoided because all the landlord needed to do is send all the tenants a letter. Dear tenant, this building is in the process of being sold. You have whatever time, 6 months. I have another organization. The landlord gave they gave the people a year. You still don't want to be, you still want to move. But if they give you 6 months, a year, 60 days, whatever, then you're going to move on it. At the time of this, I had 2 applications pending for senior housing. If I had known that eviction was imminent, I would have had 10 applications out. I would have had 20. No normal person is going to leave themselves in that type of situation where you have no way out. And that's the thing that really annoys me the most, that I ended up in the hospital. My fellow neighbor died because of the landlord. That's not, he's gonna go to hell. That's not, there's no excuse. That's not excusable. The only reason is I want to sell this building to make millions of dollars. And you can't do that on the backs of poor people. That's not acceptable. This is not slavery anymore. You can't do that. So that's why, Fred, I am so passionate about this issue. It's unbelievable. I have an awakening because of a religious awakening. And I've been called, and I posted on my Facebook book page last night, the first chapter of my book, which is going to be called Out of the Blue. All these great things have happened to me as a result of the eviction out of the blue. So read my Facebook, Brian, Facebook.com. I'll post it on the chat. I know it by heart. I want everyone to go there. I want everyone to like my Facebook. I want everyone to check out my YouTube video because we only have 81 views right now, and I need to go viral. But I like to joke that the housing and healthcare are very, 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 very serious matters, and it's life and death situations. So I'll take questions about the options, medically necessary share of cost, and also the community health centers where we provide free care for people that don't have insurance. So these workers, the construction workers that they're not documented, they've been out and they have heat stroke. They don't want to go to ER because they ask for documentation, but at the community health centers, clinics, we don't ask for documentation. If you need to see a doctor, you come and see a doctor. If you don't have money for prescription medication, we'll give you prescription. Happened to me a couple of years ago. The insulin was like $150, and I didn't have it. That's no problem. Here, here's 10 vials of insulin to keep you over for the next 6 months. Keep me alive. Sorry, that's it.
Okay. I'm gonna go ahead. Okay, first of all, I want to open it up for questions. Okay. First, I'm gonna ask Tawana, do you have any questions for Brian or Miss Joey or Amy? Any of you three speak? I want to let you guys or Susan just go in order, or even Katie. Do you guys have any questions for Brian? Any of you?
I don't have any
You guys
questions.
have? Okay.
Yeah,
Do you have
thank
any
you for
questions?
sharing, Brian.
Sure, go
Thank you
ahead.
for sharing. I know it's hard.
I don't think you guys met each other on Zoom. Brian, this is Miss Joey. She works with us in on CC with Tawana. She's Tawana's right hand and a great woman. You're gonna love her when you meet her in person.
I want to be involved. I'm a full-blown community activist. Barack Obama started his political career as a political activist. And if you find a cause that's near and dear to your heart, go for it.
Yes. Yes. Okay. I'm gonna move on. Susan, are you available to speak right now? Do I know your time limited? Okay, bear with me. She's on. I don't know if she's able to speak or not. Okay, I guess she's not at the moment, which I wish she could.
Fred, I have noise
Okay.
in the background, so I
It's
can't
okay.
really
It's
speak.
okay. I'm not.
I'm sorry, but I'm
sweating you.
listening. Sorry.
Go ahead. Go ahead. Tell your story. Tell your story about how you landed Bullets for Life. Tell them the story what you're going through without healthcare after quitting a $50,000 job, please.
Okay, hold on. Let me step outside. There's a lot of background noise where I'm at. Hi, everyone. Good afternoon. Good afternoon. Good afternoon.
Good afternoon, Susan.
Hi, sis. Hi, Tawana. Okay. Yeah, Fred, I'm sorry.
Do me
Hey,
a favor,
Susan.
please share
You
your,
want me to
please
share?
share your, please
Yeah,
share
hi,
your great.
hi, Mr. Douglas. Nice to meet you.
Please,
Okay,
thank you.
so nice to meet you. Yeah, so I am Susan, the founder of Bullets for Life, where we are saving lives one bullet at a time. I started a movement to get bullets off the streets, which is called Donate a Bullet, Save a Life. So we have our community. We go where the violence are happening, where people are afraid to go to. And we're asking our community to donate bullets. Every bullet you donate, that's a life that will not be taken by that bullet, because we're going to repurpose it into something beautiful to honor lives that's been lost by senseless gun violence. And I don't know if we've seen a lot of people around. We made it all the way to Washington, D.C. We travel all over Chicago, teaching families how to take something that's taken their children's life or their loved one's life and repurpose it into that beautiful accessory. So when you wear one of our accessories, that's a life saved, not a life taken, in honor of lives that's lost. We've collected over 20 to 30,000 bullets off the streets for the last 10 years. And this movement was started when King Carter, Ms. Tawana Atkins' nephew, were lost. He lost his life to senseless gun violence. And I was moved to action to start this movement, and we've been doing it ever since. So that's a little bit of who I am. That's what I got for you now, Fred.
Just want to know if maybe you could, I want to advocate for you now. You gave up a $50,000 a year job at Nordstrom's, 50 grand plus, maybe 75 grand, to go take bullets off the street. I didn't introduce you like I always do. I'm sorry, because I know we were time limited. But I'll say it right now. This is my dear friend. This is a great lady. And I wanted to meet this lady for those listening tonight and those listening on the replay. About 2019, I kept seeing 2018 on Facebook, this lady, and she used to take bullets off the street. I'm like, I got to meet this lady. I got to meet this lady. Went to a rally in Fort Lauderdale, almost met the lady. Went to a press conference 2 weeks later, met her. We became great friends. We became partners. I am so grateful for this lady, but her heart for children is amazing. Her heart for the community and others is amazing. But she should not be going without health care. Nobody should. Giving up a job for public good and you can't get health care is absolutely wrong. I am doggone sorry about this, but it's wrong. Wrong, wrong. It's morally wrong, period, folks, for someone to do this. Okay? You are helping others and you should be rewarded for helping others. Thank you. I got off my soapbox. Susie, you got anything you want to add?
Yeah, you're 100% right about that. You know, with doing the work that we're doing, especially we have nonprofit, and we don't have funding like we should be having. Like we've been doing this for so long, and we don't have funding. We're a small organization, so every time we sell our bracelet, that's part of our fundraiser. But not having insurance is the hardest thing to do because I have protests in the heat, and one time fainted and did not want to go to they're telling me because my blood pressure was so low and they were telling me you need to go to the emergency room. I'm like, no, I cannot go because I don't have insurance. I fought them. I did not want to go because I don't have that money to pay that bill, you know,
No.
and I had no choice but to go. Now I have an extreme bill to pay that I could not afford to pay. I did not want to go to the hospital, but it's like you can die if you don't go. So I had no choice but to go to the hospital, but I was afraid to go because I did not have the funding to pay for that hospital bill that I have that now I'm in debt because I don't have insurance, you know, because of the work that we're doing. But that's just a part of my story of not having insurance.
I thank you for this, Susie. I thank you for this, but I've walked in your shoes. I know what it's like. I can remember back in 2001 in Ocala, having an asthma attack, then a week later having a heart issue because the doctor prescribed the wrong medicine for me. And I'm begging the guys in back. I'm like, guys, I don't have any insurance. They're like, calm down, calm down. You know, we'll get you there. Let's not worry about that. And they were right to do that. But I thought I was having a heart attack at the time. And it's scary. What you went through, what Brian went through, what I went through. And then when Amy comes on with you, and it's what she went through and what Jen went through. There's just absolute no reason for this. That's why we need to care about healthcare. That's why we're doing the Zoom. And I appreciate you, Susie, for doing it. Now I want to open it up for questions. Tawana, Joey, Amy, Brian, if any. Okay, go ahead, Brian.
I'm going to say, there's no reason for that because when I went to Jackson and I was admitted, and it was a bill for $40,000. Medical necessary care, of course, picked that up. You have to look into that. University of Miami has financial assistance, have Health Choice Networks. We have a network of free clinics that if you do not have health insurance, you pay on a sliding scale. If you're dirt poor, like an illegal immigrant, your care is free. If you don't have money for prescription medication, we will give you prescription medication. So I'm tired of hearing these stories. I don't go to the doctor because I don't have insurance, but we have a place. And we're working right now on outreach, going out into the community to do outreach at street fairs, at community events. If you don't have insurance, come to us. There's no reason not to get medical care if you don't have insurance.
The problem with it, Ryan, is they're so swamped with care that you can't always see a doctor. I can remember at Jackson one time I had a J2 card and I went to the clinic. This was in 16, and I couldn't even get in. I had a throat infection. I ended up having to pay, which I fortunately had enough money to do so, my doctor who I have now, and she treated me uninsured. And even some doctors like Dr. Powell will treat uninsured people and they will have a plan for you. You know, I'm going to go ahead and bring on. I'm going
to talk about Health Choice Network. That's a misconception. It's gotten much better, right? You used to have no problem before. You could not get an appointment for them. You'd call, it will be 2 months. What we've done now at Camillus is to make it more accessible. We've extended our hours. We're open now at 7 a.m. to 7 p.m. because people need health care that don't have insurance and they shouldn't have to wait 2 months. There's the CHI. I mean, talk to me offline because I hear that's a misconception. We have room. We have walk-ins. We don't have an appointment. Talk to me offline.
Brian, this was 2017 when this happened to me. I know a lot has changed, but this was 2017.
I'm talking about.
So bear with me. It was 2017. I was lucky. I've had healthcare for 5 years and I got Medicaid, but I could be in the same boat. So I understand what you're saying, and I appreciate what you're doing because you're trying to get us care, which we desperately need. You know, Because not
Yes.
every doctor is going to be like Dr. Powell. So I appreciate what you're trying to do.
Yeah.
Do you have any questions? Yeah, well, I got you. Do you have any questions for Susan? Do you have any questions for Susan while she's here? Do you have any questions for Susan? All right, then. Okay, thank you. Then we're going to move on to our next speaker. All right, Amy, you ready? I'm going to have you share your story, and if anybody has any questions for you, any thoughts you have, I'm going to introduce you real quick. Ladies and gentlemen, let me introduce you to the co-founder of Impact, Mariami Amy Rodriguez. Active since 2013 when her daughter Genesis Rodriguez had a severe respiratory issue. This young lady at the age of 17 had major surgery at Jackson Hospital. It's in the Miami Herald and also in the Washington Post. She had part of one lung removed. Her daughter is now 28 years old. She has a healthy 7-year-old daughter named Safira. But for a long time, it was very touch and go with her daughter, Genesis, because Genesis had one lung missing and one lung. We thought a few times we were going to lose her, and that's terrible. And we do not want any parent to go through that. And Amy also suffered without having health care herself and has had diabetes because of it and is struggling right now to pay for insulin sometimes and medical pumps and devices. And we've had to do GoFundMe's for both of them, which we should not be doing GoFundMe's in America. Thank you, folks. Amy, go ahead.
Hi, everybody. How can you hear me?
Yes, we can.
Okay. Well, my name is Amy, aka Amy Mariame Rodriguez. That's my government name. And yes, like Fred stated, I do have a daughter who had a lobectomy in 2012, right before high school graduation. And she lost her Medicaid right after she had surgery. So she had surgery in 2012, and in 2012 they discontinued her Medicaid, and in 2013 is when I started my battle with advocating for her and about the need and the importance that it is for having Medicaid, because that's what's going to provide medical attention and that's what's going to provide your medications. At this moment, we're fighting, we're dealing with a situation also with Medicaid. She is 30 years old. She does have a 7-year-old child. And right now she's battling a couple of issues with her medications because unfortunately, due to probable Medicaid cuts, and a lot of other issues and a lot of problems that have arisen lately, she may lose her Medicaid. So with her, by her losing her Medicaid, that's basically signing a death sentence.
True.
She won't be able to get her medical care. She won't be able to see a pulmonologist or get all her medications that she needs to help her breathe on a daily basis, to be able to be a mom, to be my daughter, to be my friend, and to take care of everybody else, because that's basically, that's her forte. She likes to take care of people. As far as myself, I've been a diabetic since 1996. I had a lot of care when I lived in Connecticut. Over there, the medical care is a little bit different here than Florida. So I was able to get my insulins and my treatments and everything that I needed as far as diabetes in Connecticut. But when I moved down here in 2005, it became a roller coaster, because when you don't have insurance, you need insulin to live on a daily basis. For those who are diabetics, you know that diabetes is like a yo-yo. You're good today, you're good tomorrow, you're high today, you're low today, you're low tomorrow. I mean, if you're diabetic, you know what I'm talking about. It's just a very rough journey. So I had when I got here to Florida, I because my kids were minors, I was able to qualify for Medicaid. But as soon as Genesis turned 18, Medicaid went away. And that's when my battle began with trying to get access to insulin and access to all my diabetes supplies. But now for the past, you could say maybe about from 2021 to 2023, I had Marketplace Insurance. The first one that I had was Bright Health, which was not as bad. And then the second one that I had was Oscar, which was a total nightmare. They didn't cover anything that pertained to diabetes. They didn't cover. I was having to pay $279 for a vial of insulin. I was having to pay $200 a month for pump supplies. So if you know how hard diabetes is, then you can understand where I'm coming from. My push to advocate for Medicaid expansion is for because it'll help people like myself. It'll help Floridians like my daughter who need the help, who need the care, who need their medications on a daily basis. So we need to push. We need to rise. We need to scream. We need to get them pots and pans out there. We need to make that noise because let me tell you, they're coming for it. They're coming for it and they want to be gutted. So that's just me. I mean, if you have any questions, feel free to ask me.
Okay, great. Thank you so much, Amy. Appreciate you as always. Let me just say one thing. We got one thing real quick, Brian, before I go. We got three New Yorkers in the house. We got Manhattan with Amy, we got Brooklyn with Brian, and we got Brooklyn with Susan. We got 3 New Yorkers in the house today, guys. 3 boroughs represented today. You also be proud of that little thing too. Little gem to throw in for the entertainment purposes.
Okay.
So I'm gonna ask you real quick. Does anyone have any questions for Amy right now? Anybody? Brian, Tawana, Miss Joey, anybody have any questions?
Yes. As you see,
Go.
I don't know what's going on. I'm shouting because I'm diabetic. And they gave me free insulin syringes. They gave me the machine, the chest sugar. They gave me blood pressure, all free. If you don't have insurance, no problem. We'll see you for free. I got behind in my payments. They gave me a payment plan, $10 a month. That's what I'm saying. You know, I put I'm bringing it on myself, but I'm putting my email address out there. I'm putting my phone number out there. I'm on Facebook. I'm asking to be flooded, but I don't like hearing these stories because that's not the case today. In 2025, we're doing more outreach now because we're trying to get more patients in because our census is low. So think maybe 10 years ago when you had to wait 2 months, that's not the case today. Show up Monday morning, 8 a.m., tell me you're walking, may have to wait all day, which but we're going to see you or take care of you. So I'm just yes, so what the Camilla said, we're excellent. The medical director, Dr. Sarah, and I are best friends. We text every single day. But again, Fred and group, Brian Douglas is only one person. I can't. I can't do this for everybody, but I'm putting myself out there because I'm listening to these stories and I'm shouting, no. I didn't have any insulin. No. Come to Camillus. Call me. I live 3 blocks from Camillus. I'll walk you in there and we'll go to the back to the pharmacy and I'll get you insulin. So let me.
She had no insulin. I started working with this lady in 2015. She had no insulin from 2015 to 2021. What happened was, Brian, this is what happened in Florida. I lived it. I know it myself. When Rick Scott failed to expand Medicaid, it affected Amy, it affected me, and affected Genesis and several others. It's still affecting others. Katie, who you can hear from in a few minutes, will verify this because she works with Scott Darris, the chairman of Florida Voices for Health. Even Destiny can verify it. You can ask Ideal. What we're saying is the reality. Now, what Camilla's is doing is a huge help because it's going to alleviate what Jackson is doing. However, in a person like Amy's case, she has insurance now, and the insurance is soaking her for a vital thing, which is an insulin pump. It has soaked her for it. You know, she had to do a GoFundMe, which we had to help her with. We had to beg for this. Nobody should have to beg for care in America. Thank you.
No, I'm saying, Fred, but if you're underinsured, the problem that I had with Cabela's and also with University of Miami is that I had insurance, but with the insulin a couple of years ago, before it changed, under Biden, you had to pay $150 for the vial. And that I cried, I can't do that, I'm gonna die. So at the University of Miami, Dr. Filippo gave the insulin. That's what this, I mean, I like these sob stories. I did community affairs for 20 years in New York. No, under my watch, no one's gonna die, and under Brian Douglas is watching or have insulin. If I have to go to every clinic in Miami-Dade, I'll get you insulin. Sorry.
Can I interrupt? I've had my hand raised, and I'm not sure if you saw my comment or hand, but I wanted to add some thoughts and feedback.
Yes, go ahead, please, Acadia. Please do. Please do.
Awesome. So for anyone I've not met, my name's Acadia. I'm with Florida Voices, and I actually just got back from DC at like midnight last night. And I just want to make clear for you all, what Marimilu was saying is exactly correct, right? Florida refused to expand in 2016. There is currently an active campaign to expand Medicaid, and they need more stories. So if you've not yet shared your stories with Florida Decides Healthcare, we have an amazing new campaign director, and they're gaining momentum. And in this moment, they're pushing back against national pressure. There's currently $880 billion in cuts, which include a tax. It's like 13 million people will lose Affordable Care Act coverage and Medicaid coverage. They'll be instituting work requirements, mandatory biannual re-eligibility checks, and ultimately tons of folks will fall through the cracks with this new Republican plan to slash Medicaid. Your local Congress people in Miami-Dade are actively voting to get rid of what limited healthcare exists in Florida, including through the ACA and Medicaid. And if you've not yet written emails or called your legislator, right now is when they're considering this budget in DC. Like, this is actively the House, and it's taken 5 months since the new government took power to get this budget even as far as it's gotten, because there's so many people across the aisle who are so angry that their healthcare is being taken away. So there's bipartisan support to protect Medicaid. The conservatives are trying to they're trying to force a vote through the reconciliation process. They don't have the votes to do a normal vote on the House floor. So they're doing this back alley reconciliation with the budget, trying to get things through since it's so vastly unpopular. And just to say to you all, Mario Diaz-Balart, his office, all of the local Congress people in Miami are actively giving the green light for folks to take your limited access to healthcare. So I'm going to put numbers in the chat, but just please, please, please reach out if you haven't already. I know what we have in Florida is already limited, and really there's so many people who don't have access to what they need, but it could get so much worse, is my fear.
Thank you, Katie. I appreciate you for saying that and chiming in your 3 cents. I will give you a ray of hope. My congressman in my district, Frederica Wilson, for some of us in Miami Gardens, is an absolute no. She's a Democrat. She's an absolute no. I called her 3 times, got the emails. She is going to be an absolute no. And she said, promise she will fight to stop these cuts from happening. So we do have help. We just don't have enough help. What we have to do is pray that about 5 or 6 people have a conscience at the end of the day and say no. 5 or 6 votes on the other side, and this thing's DOA, and that's what we need to keep our healthcare alive.
Exactly. And I think in Miami, it's like 1 in 4 people rely on Medicaid. And it's like more than half of the kids in your county rely on Medicaid. So it's a massive program that so many people lean on, even without expansion.
Right. It is. It's ridiculous what we have to go through. It's ridiculous, but thank you, Ms. Scott, for all you do. And can you please leave in your chat? Because I'd like Brian to connect with you. I think he can help you guys out if he has time.
Yes,
I think you can. I think you need to work with these people. I
don't have any time, but this is a mission for me. That's why I joined these boards. Because I I can't hear these stories. I'm a human being. These Congress
Right.
people, I can't hear these stories. I gotta help you, even if I have to do it myself.
Great. But you're not alone. You got a great team. You got me, you got Amy, you got Simone, you got Miss Joey, you got Acadia
Yeah,
here, you got
yeah.
Destiny, you got a wonderful Catalyst family, you got a wonderful Worker Center family. We just need to put the word out that this is happening, and these people will sign a petition which Florida Decides Healthcare, which is associated with Florida Voices for Health and Catalyst Miami, and I've signed to get Medicaid expanded in this state. So then we get Medicaid expanded, and 500,000 to 1 million people have healthcare. Then they also have mental health counseling, which is a great thing. So I'm going to segue right now to my dear friend, Ms. Joquetta Griffin Batista, to share her story. She's a wonderful, wonderful, wonderful advocate on healthcare, mental health, and also homelessness. Wonderful women's rights advocate with her great organization, Collective Sisterhood Inc. I give it to Miss Joey for about 5 minutes to share her story of why Medicaid and healthcare matter for families and children. Miss Joey, you ready, please?
Yes, and I'm a part of Community Collaboration Exchange, Better Me. You know, we stand in solidarity with great groups like yours, and especially Community Collaboration and Susan Bullets for Life. So I think that it's important because people need access to health and wellness. We attended an event this morning. I think it was One Healthy Voice. I think that's the name of the initiative, but it was very critical. It was like maybe 100 seniors in that room. And a lot of them had conditions and they had concerns, but you know, they at their latter days. And so I think it's important that families have it because children, they can't focus in school based on the ACE tests and stuff like that, that they are affected. And so we need to make at least free lunch and affordable health care so that they can have a thriving chance. And I'm complete.
Thank you very much, my dear friend. I just didn't know if you wanted to talk what you like what you went through with your kids, real quick, when you were younger. So I want them to understand it. But if you don't want to, it's okay.
No. I thought you said tell them how it affected families. I'm sure.
My bad. I meant your family too.
Oh, I didn't know. Well, I was
Yeah.
without health care when my kids was growing up, and that was a bit discouraging as a single mom. They had programs like Florida Healthy Kids, and some of the challenges that was faced with that was that within the 30 days, if you didn't have the money to pay for the service, you can lose the health care. And whatever treatment plan you had started initially, it could be altered. But thank God that Florida Healthy Kids existed because I was able to find people in the network to help them. A lot of times my check was just barely enough just to sustain the basic necessities for my children. And I would go into the emergency room, and before they give me the prescription, they even started putting ATM machines in there. I had to like be innovative and an outside thinker to be able to like avoid um, saying that I didn't have the money for the payment. And so it was devastating. And till this day, my children pride themselves on having insurance. And so I spoke to a wise woman before that told me that when you work for your health care and your insurance. That's one thing that you should invest with on your job is to make sure you pay for health insurance. But for some, that's not afforded that opportunity. But we need it because a lot of our kids are coming out with specialties, autism, and stuff like that. And I think that they need a fighting chance. And to hear that they won't be able to do it, that would be devastating. And that would be just something that would be like disturbing to me. And the fact that people can't get insulin is disturbing for me. And so I think that now is the time. And when Arcadia spoke, if you can give a short link and if we can do some phone banking or whatever it is, I think that we're doing that with Black Voters Matter on the other end. But whatever we can do to push the word out, I'm down to do it. And I'm complete.
Thank you, dear friend. Appreciate you as always. Does anybody have any questions for Miss Joey real quick? Anybody, Brian, Susan, Amy, you guys got any questions for her real quick? All right then, guys, I'm going to wrap it up with our next to last speaker sharing her story about her family situation. And I want to bring on the leader of Community Collaboration Exchange, which I'm a proud member of. I'm sorry I didn't bring it, but I wanted to wait to introduce her properly. The amazing Miss Akins, assistant principal, Miami Southridge High School, decorated teacher of the year, community leader. Can't say enough words about this woman. She's a dynamo. She can host meetings. She can teach your children. She can tutor your children. She can do events. She's just, like I said, an amazing dynamo. So I'm going to bring her on for about 2 minutes just to share her story. And if she has any other thoughts, I want to bring on the amazing, my dear friend, founder of Community Collaboration Exchange, which I'm a proud member of, with Miss Joey and Amy and Brian and a few of us. I want to bring on the great Ms. Tawana Akins right now. Thank you. Tawana, you ready?
I'm here, Fred. Hi, thanks for the introduction. I wasn't prepared to speak. I was just listening in tonight. So I'm here. I know that healthcare is very important. I'm happy I do have healthcare, but I just want to share a story about teachers once we retire and we need healthcare. And with our retirement that we have, out of that money, we have some teachers paying up to $1,500 per month for healthcare out of their hard-earned money after retiring from the Dade County Public School System. You're out on your own and you have to provide your own healthcare. So my godmother, who is retired, and my other godmother, who's also an educator who's retired, they're paying up to $1,500. So if you have, like, if you don't have so good health, because health problems going to arise, you're going to be paying a lot of money once you retire, and it comes right out of your hard-earned money that you have already worked those 30 plus years for. So I'm complete. That's all I wanted to share tonight, and thank you.
Love you and appreciate you, Miss A. Thank you for it. Does anybody have any questions or thoughts for Tawana right now before I go to Acadia? Okay, then I want to thank everybody for coming on, Acadia. I'd like you just to give me about 5 minutes just telling what you and Scott do. But before I go on, let you come on, I want to say one thing. There's a young man that I wish could have came on with his mom, and they're out of Orlando, Florida, and they're tireless advocates like we all are. And their names are JJ Holmes and Allison Holmes. JJ has cerebral palsy, like our dear friend Jasmine Samuel does. JJ has to use a pencil to type, to speak. In other words, he will have them demonstrate it. He will have to speak like this. This boy is like 20 years. Katie, how old is JJ? Is he 20 or 21?
JJ's 19, I believe.
19? Okay. 19 years old. Cerebral palsy. My dad had cerebral palsy. I know what it's about. I have friends that had it. Susan and I lost a dear young woman who our dear friend Letha Cheryl Bush's daughter, KK, Shaquare Washington, had cerebral palsy. It's not a picnic to have CP. And these people with CP, they need a lot of services. JJ has help, but his mom, who's taking care of him, Allison, does not have health care. And she has to move him, lift him, bathe him, and dress him every day. And folks, that's no picnic, okay? That is no picnic. We need to do this for people like her. And for JJ, who needs the home care and community services when his mom can't do it. This boy is going to college. He's going to be a political science major, He is going to do a lot of good in this world and has advocated so far in his young life. We need to do it for folks like him. I wish he could have came on tonight so y'all could have heard him. Hopefully, some way in the future, I can connect him. Hopefully, Acadia, and we can do something. But, I understand they got a lot of other stuff going on, too. But, Acadia, I'm going to throw it to you now.
Sure, thanks so much, Fred. I think I already shared quite a bit, but just Florida Decides Healthcare, I've had the privilege of working with for about 3 years now. I used to live in Miami and then Broward at the start of the COVID-19 pandemic, but I'm originally from New England and, myself benefited from what they called Romney Care back then, which was the model for the Affordable Care Act. But yeah, Florida Decides Healthcare was founded by healthcare navigators, people doing outreach and enrollment, specifically around the issue of how many people in Florida straight up don't qualify for care. There's so many different barriers and, thankfully we've had these little bits and pieces of progress the maternal Medicaid expansion, the kid care expansion, and that's caught up in the courts. There's been little bits and pieces here and there. And I think we have seen that there's significant pressure. The Live Healthy bill that passed last year in the Florida House and Senate showed the amount of pressure there is in the state to really address the doctor shortages, the ER overflow, and just how many people can't, even through like charity care and free and charitable clinics, those places don't have the infrastructure to offer long-term preventative care. People, can swing through and maybe get, if they're lucky, a short-term visit, see a doctor, get their issue dealt with. But really, people are scrambling to find a provider who they can be with long-term and get their chronic issues dealt with. So it's very costly. And ultimately, it's not just like dollars and cents, but lives lost at the end of the day. So we do this work both at the state level. We spend lots and lots and lots of time bringing storytellers up to Tallahassee to meet with elected officials, and also connecting them to opportunities for action to move health policy forward in your own district. So if anyone's ever interested in sharing your story with your elected official and want some support and resources, training, need gas money, a place to stay, or just more generally are curious about how it's all done, we offer all of that at Florida Voices. You can see our website, healthyfla.org. We also then are doing increased, since January, and I'll say we also were doing it back in 2016 during the previous Trump administration, but we're doing tons of Medicaid defense work. So like I said earlier, we were just up in DC doing visits with these folks who are voting to get the Medicaid program and revert back the ACA eligibility. So it'd be really damaging for people, not just in Florida, but all over the US. I put a bunch of links in the chat, including like a petition, an email link, basically like a hotline operations phone number to call your elected official, but then also specifically a Google Doc link, which is for Florida Decides Healthcare. That's the ballot initiative campaign. It's a citizen-led initiative to get Medicaid expansion on the ballot. 79% of Floridians support expanding Medicaid, including like 69% of conservatives. So it's a hugely bipartisan issue. We just have to get the signatures to get it on the ballot. And then it's basically a guaranteed pass. So I encourage you to share your stories, sign a petition, and just get involved with us also. If you want to do some legislative advocacy, it'd be awesome to have you all hollering at your elected officials too. I say hollering, but really we're very diplomatic.
Real quick, Katie, I got a quick question for you. Or Tawana, I got a quick question for you real quick. When is our next CCE Zoom meeting? When is our next one for the Sunday? When will it be? Do you know?
Whatever the last Sunday in the month is, I don't have the calendar in front of me.
Okay. Acadia, love to have you come on. I can get you the information if you're available. Love to have you come on for a few minutes just so you can see what we do.
Out of state the whole last week of this month. Unfortunately, I'm out of state. It's my annual vacation of the year, end of May.
Oh, okay.
So I don't know that I could make something, but we could find someone else. If it's the last week of May, we can find Scott or another member of the team.
We usually do it's a Zoom. It's a Zoom. Ask Scott if he can cover it.
Okay, yeah. If you can just send me the date and time, then we can double check who's available.
Yeah. Okay, great.
Thank you for thinking of us.
Yeah. Okay. Does anybody have any questions for anyone? Brian, I want to thank you. I know you did a heck of a job. I know you got to get out. Does anyone have any questions for anybody before we sign off? All right, folks.
Yeah, my information is all there. Chat. I can be texted 24/7. Send me an email. I don't do phone calls because tomorrow night we've got budget hearings on transits. Next week I'm going to be in Washington on housing.
Okay, folks. Sorry I left you for a second. I want to read you this. I wrote a little poem about gun violence called How Many? But because I'd like you all to think about this before we close. Let me get to this. I got to find it first. Bear with me. I'm reading this cold today. Okay? But How many took on a life of its own? And I kept thinking to myself, what about the people who don't have health care? Okay, so I came up with what they call how many three. So bear with me, I'm going to read this to you real quick before we close. How many three, the healthcare version? How many tears must we cry? How many times must we say goodbye when someone we love dies because you deny? How many times must we sigh and mourn and cry because you deny? How many kids must die? How many moms and dads will cry? How many could die because you deny? How many Americans will cry, why, when someone laid up dies because you deny? Too many fears, too few years. Our years are being taken from us in our fear because of medical debt. Because you deny. How many more will say enough, and how many of you are going to rise up and say enough when you deny before our future dies, before it begins? I wrote the original How Many about kids and adults dying from gun violence, but I modified this version for healthcare. And if you think about it, you're taking years away from us when you take our healthcare away. When you deny us healthcare, when you deny claims, you're taking our healthcare away from us. We need to do better as a nation, and I want to thank Brian for fighting. I want to thank Tawana for fighting, and Miss Joey and Amy and Susan and Acadia for fighting, and Destiny in the beginning for fighting for this great cause. And I want to encourage everyone tonight to get out there and make some doggone phone calls. Make some phone calls. Call your congressmen, call your senators if you haven't. I did it twice already. Email them. And those on the fence with other issues, climate change, gun violence, healthcare that are listening, please make these phone calls because it does affect your issues, whether you realize it or not. Housing does. Because if you think about it, a person like Brian is going to get evicted. What if they don't have healthcare? God forbid they have heart disease, high blood pressure. What are they going to do? Have a double whammy of no healthcare and no place to live? This just is not right. And I'm sorry, folks. I want to thank you all for being here tonight. I appreciate you, Miss Joey. I appreciate you, Tawana. I appreciate you, Brian. Your horse. You're going to have a great future in this. Acadia, I love you for coming too. Love you, Tawana. Love you, Miss Joey. Love you, Amy. And love you, Susan. I want to thank you all, and God bless you, and praise God. Thank you for this wonderful opportunity. God bless.
Thank you, Fred. Have a wonderful evening.
Thank you, Fred. We love you too. Bye.
Fred.
I gotta go. Next meeting.
Good night.